Good. Coming to question number 6. Is it safe to put the arms on Galileo platform to train supporting function? Yes, no problem. If you put the lower arm or elbow, then we use normally a thin rubber mat if we have direct bone contact. If you use the hands, then you can normally use the hands directly on the platform. But if you have bone contact with the lower arm or with the elbow, then we normally use a rubber mat, but no problem to train with the elbow on the Galileo system. Maybe Tatьяна want to comment something?
Maybe I wanted to ask you, Harald. I heard that the work safety requirements, in work safety requirements, it said that, or somewhere else, I don't know, around this, so that the threshold for vibration for the arms is 4 times more in compared to legs. Have you heard about this, anything? So
I have no exact number now, but very clearly, if you look what workers are using, if they're using a drilling machine, if they're using other tools to build a house or something, of course, the acceleration are much higher than what you get during Galileo training. So the acceleration which you use with normal working tools are much higher than using Galileo. So, and therefore, if you use a pneumatic hammer or if you use, again, a drilling machine or something, then the acceleration are much higher than what you get with Galileo. Mm-hmm. And again, Galileo is a sinus wave. All what you get in occupational medicine or in occupational working environment is normally a mixture of frequency and not a sinus wave what you get in Galileo.
Mm-hmm. Yeah, and I only would like to add that those exercises with the arm support also very important in the ontogenesis, from the ontogenetic point of view, and it helps, of course, to support the head control, neck control, improve the muscles' ability to control the posture around the arms and also around the trunk itself, so around the spine, and also it just directly helps to straighten the arms and to go in the direction of crawling on all fours. And different transfers that all those kids needs. So that's why, of course, we need, and we need to use it, but we need to adapt the position of the child, and in some situation we need to find the position where the head is really nicely organized over the midline. So over the axis, central axis, and then we don't have any problem, only improvements, and usually high frequencies. That's what Dagmar taught me 10 years ago, 24 hertz. It's very, very good, and that's what is really still working, and I really know that we will improve the strength and the ability to support if we use this position. That's just the reality.
Yeah, and normally if you use straight arms, then you use maybe a little bit lower amplitude. With flex arms, you can use also larger amplitudes. And one comment again, so our body is designed to transfer forces through our arms and through our legs, feet. So this is during normal activities where the body is designed to transfer loading through the arms, hands, and to the feet and the legs. So these are normally the 2 most important things to train.
and also if we speak about the arms and hands, so I think we can say that the dumbbells that you also produce also very helpful, because we can really grasp, so that the children can grasp and they train this grip, which is very important for them to be able to close and open the hand, in comparison to the position where the hand is open and the fingers are spread. So it's, again, from our Voita concept with Maria, we know that we assess the spontaneous movement from this point of view, how the child is grasping, how the child is actually supporting. So it's a very important part, and I'm so glad that we can influence this with your devices. So.
Yeah. And especially if you have a child with spasticity in the hand, etc., then the dumbbell is, I think, a tool where you can really, in minutes, reduce the spasticity and work more functional. This is really something which I think, especially for occupational therapists or ergotherapists, that the dumbbells could be really a helpful tool.
Correct. Thank you.
Thank you.
So now coming to question number 7. Children with hydrocephalus and shunt, could you please comment the following statement? Because of the vibration, the shunt in the brain can be damaged. Well, we have one study where especially they have stated that shunts are no problem. This was a study which was done in spina bifida children, and they have seen no problem with shunts. And in Cologne, again, hospital, they have many children who has a shunt, and this is no contraindication. And we have never seen problems. With shunts, you can have other problems. If you look in this from the manufacturers of the shunts, there are often other things which maybe cause problems with the shunt, but during Galileo training, we have never seen problems directly caused by Galileo.
I would maybe only add that you need to find reasonable positions for the exercises. So maybe I wouldn't recommend to use upside down position, for example. I'm not going to use it even in without Galileo. So just a reasonable, just be reasonable.
Yeah.
So think what you are not going to use anyway, and do the same on the machine, and then you will be safe and sound.
Yes. So coming to the next question. Can we use Galileo with patients with endoprothesis, metal constructions, for example, presence of spindles, plates in the joints after fractures? So basically, artificial hip and knee joints are in the moment a contraindication with Galileo because we have no large study. We have small studies who showing that the loading in these artificial joints are less than any walking exercise. But we know that 1–2% of these artificial joints can be loosed by something else. You have bad surgery or you have bad bones, and then you can maybe have problems with your artificial joints. And therefore, only as a precaution, we have now in the moment artificial hip and knee joints as a contraindication because we have no large study, but we have a lot of therapists and doctors who has artificial hip and joints which are using the Galileo for her personal experience or for personal use, but not in a clinical setting in the moment. On the other side, pins, screws, plates are no contraindication. So we have even children with osteogenesis imperfecta, we have bone nails. Normally they can train on the Galileo because the loading with Galileo is very small, and therefore we never had any problems, and it's in the moment no side contraindication to use if you have pins, screws or plates.
So it's also it's also important for the patients, for example, with cerebral palsy, the patients who have a very strong scoliosis and they have to get the operation on it. So after the operation, they are able to use the Galileo platform logically.
Yeah. So again, even with children with brittle bone disease, with osteogenesis imperfecta, they can train on the Galileo because the loading is so small. Any other exercise, for instance, if they would do a resistance exercise, the danger is much higher than using Galileo. And this is a big advantage, that you have the stimulation effect of the Galileo system, but small loads. And this also is, for instance, also used in high professional sports because a lot of like for instance, ski jumpers, they normally weigh about 40–50 kilograms. They are very thin. And they have to make normally resistance exercise, but to reduce the loading, they also use Galileo to train their muscle system without putting high loads, because the risk to injure these high performance athletes is quite high. And this is a big advantage also used in high professional sports, where these sports people can use less loads to train their muscle system.
And maybe I would add a practical example. So I personally had a patient after the spinal cord injury, and that was the very first machine that was brought to Russia. It was more than 15 years ago, and she was around 30 years old, and she had screws and plates, everything that is needed to, for the fixation of the spine. And actually, at that time, my German colleague showed me what to do and how to train this woman. So I really didn't think if it could be a contraindication or not, because she told me that this is safe. So we were doing this Galileo training, I would say, for years. Now she immigrated to Spain with a platform, and she's using this for 15 years. And she had to recheck her condition with the spine, but sorry, it was after 11 years of training. So they had to a little bit, for the screws to make them a little bit tighter, to tighten them. But nobody knows if without any training that wouldn't be a problem. And also as an advice for those who undergone the operation with scoliosis, for example, I would say that at the beginning, for example, a roller, like a soft roller, could be helpful for the positioning at the beginning, when the control is not yet there. So we can use a support, for example, in tilted, like in the
tilt table,
some position like this. So, but we can speak about this later, so I can show on the machine. But it's a very nice, I would say, a beginning for the muscles of the spine to be activated.
Yeah.